Welcome back to a special edition of the Walk the Talk America Guns and Mental Health podcast. This is an after hours edition. So, Kevin, I'm going to put on my sexy voice, talk to our guests in a sexy manner, because I know it won't make him uncomfortable. He has a hell of a sense of humor.
I'm going to try
Before
to
we get
match
to
you
you,
with that deep voice.
that Barry White voice, the after hours special. No, but before we get to you, James, I want to thank you, Kevin, for coming on this late. You know, I know you got a family. Appreciate you coming on the After Hours podcast. And I hope we have people joining us. This is a unique hour, but we're going to talk about something very interesting today, I think, for the general public in the firearms community. There is a fear that many people have, and Walk Talk America is living proof of that. When they go to see a doctor, physician, family medicine doctor, anyone, right? Pediatrician, anyone, podiatrist, and someone brings up the topic of firearms. And if I had $1 for every time someone contacted me at Walk the Talk America and said, I went to see this doctor and they asked me this question and I just lied, but I want to know why they were asking. Right? We'd be able to cover salaries for a whole year. Happens all the time. It happens when I'm at SHOT Show, walking around, talking to random people. It is a problem that we have in the United States that I'm sure the common man doesn't even understand, doesn't know about, but it's real. It's a real fear that gun owners have when talking to a doctor. And today, our guest is someone who's in a unique position, in my opinion, because you're one of the first doctors I've ever seen that's put aside however you feel about firearms. Obviously, I know you grew up around them. You grew up in the state of Wisconsin. Firearms are something that's in everyday life, but that's not what this is about, right? You said, I need to develop a program where I can teach other doctors to embrace gun culture and understand it. You don't have to be for it or against it. That's not what this is. This is about understanding. And you really pioneered that. And we got a chance to meet in Wisconsin when Jake Wiskerson and I were speaking at an event that was in northern Wisconsin, a very rural place, which is just an awesome experience. But we developed a friendship from there, and been at the conference, the Gun Violence Prevention Conference that was in Seattle, right? So now we're running in the same circles. But without further ado, I'd like to introduce the guest of the hour, James Bigham. How are you, sir?
Hey, thanks so much for having me. It's great to be with you. Thanks for the after hours invite. This should be fun. Looking forward to it.
Yeah, absolutely. But why don't you, I can do all the intros I want, but nobody knows themselves better than you do, James. So why don't you just give us a little brief history about yourself and kind of how you got to where you're at, and then let's get into all the interesting things that you're doing, because what you're doing is to me, it's crazy in terms of gun owners want this they want, as much as we say no one understands us, we want people to understand us, right? And I think you're kind of kicking down that door and doing it. So tell us a little bit about yourself and how you got in this position.
Yeah, thanks. In so many ways, I think there wasn't like an aha moment as much as it was just realizing, I think this is like part of my job as a primary care physician, and in realizing I don't think I actually had the adequate training to actually in a meaningful way engage patients in talking about their firearms and just open dialogue, not judgmental, about what's our plan to make sure we're being responsible, what's our plan to make sure we're going to minimize risk to our family, to ourselves. And in looking back over even just like the course of my training, I did all my training at the University of Wisconsin, and honestly, I think all I was ever taught about talking about firearms was when I'm doing that mental health screening with my patient, I ask about thoughts of hurting someone or hurting themselves, so homicide and suicide. And then I ask about access to firearms. And I kind of like hope they say they don't have guns, because I don't actually know what to do with it, to be honest. Like, I feel like that's kind of the training I got. And that's not a dig on my medical school or even where I did residency. It was just not really part of the training. I think in so many ways it was just this other thing. And it was assumed that you just say, well, then get rid of your guns. And as I've built relationships with patients who own firearms, I mean, in the state of Wisconsin, almost half of homes have firearms. I've realized that's just not practical to say, oh, put them away or you shouldn't have guns. Much has been said about the American Academy of Pediatrics saying the safest home for a child is one without a firearm. And I think that probably is an absolute truth. Like it probably reduces your risk. And I guess I've realized I had a blind spot on that when I also thought about kind of reframing it, because I think the safest home for a child is also one without a car. And when I say that, I feel like, boy, that hits different. That just doesn't feel practical or pragmatic to me. That feels out of touch. If I were to say that, if you were to say that to me, Mike, hey man, you got to keep your kids safe, get rid of your car, I'd be like, this guy's out of touch. Like I would, you would not be building trust with me. I would not feel like I could actually listen to your advice. I could see why people would duck the question, just lie about it. And so in so many ways, I feel like I've had this chance. I've been welcomed into a space to learn more. And I just appreciate that so much because I work with medical students all the time. And I tell them we all have blind spots in our lives. And the only way we find them out is if we ask, like we check them or someone points them out to us. And I'm just grateful for the chance to have built our friendship and the chance to like check in with you and ask you honest questions and have a safe space just to honestly do my own learning. It's been really awesome to have that opportunity.
Yeah, no, that's awesome. So like when I think about what you just said there, right? Like, and I always said like it's like common sense to me when someone said that, the safest home is a gun without a home, right? I've always been like, yeah, of course. Like, and if you get rid of alcohol, all alcohol, you probably reduce drunk driving by X amount. Like there's these little things that we are kind of like absolute, we know that, right? But it's really interesting because when it comes to a firearm, I think the mentality of most gun owners is no, our home is safer now that we have a firearm in the house, right? That I need to be able to protect my family. I need to be able to protect my child, right? And then here you have a group of people saying, no, the safest home is a home that doesn't have a firearm in it. And I think there's nuance there, right? To have that discussion. There are times when a home is safer, like in my opinion, and you can tell me if you disagree with this but like if if you absolutely have somebody who's in crisis or in a bad way, maybe the safest home, maybe it is worth the gamble to remove the firearm from the house until you can deal with the internal crisis, as opposed to worrying about, say, you know outside forces breaking into the home with that bad timing. What are your thoughts on that?
Yeah, I mean, I think we know, I mean, data shows like 80 to 90% of folks with a firearm say they have it for personal protection. That's been a huge cultural shift in America. I mean, back in the 1940s, folks had firearms for hunting. And so there's been a shift. I guess I feel like the big thing here is my job isn't actually to tell someone like should they or shouldn't they own something. I just want to engage in conversation about like the most important thing, which is reducing risk of injury. And so I've actually had to think more about this, and I think a better approach is simply encouraging responsible ownership, which then entails things like secure storage or staging and ensuring that there's training that folks actually know how to use their firearm. If someone thinks they want to actually draw their weapon in their home to protect themselves and their family, I hope they've actually been practicing their plan, because no one is actually Rambo at 3 a.m. if you've never actually practiced. I mean, no one's actually Rambo at 3 a.m. anyway, but just the whole idea is trying to create more space for dialogue around this and helping people just be thoughtful about what they think they might want to do. And really, I think my job is to try to be a not judgmental kind of sounding board and just ask that next curious question to help the person make the right choice for themselves.
Yeah, no, that makes sense. And Kevin, with our survey, what's the number one of the biggest asked questions, right?
So yeah, with the cultural competence course that we have for free for mental health clinicians mostly, but all kind of medical professionals, the number one request is like, hey, could you guys give some mock scenarios of just having these conversations, like you say, of how do you bring up the firearm and like, what if they say yes, like how do those go and get past the awkwardness and how to do it naturally that doesn't bring up a bunch of kind of defenses or like Mike says, straight up lies.
Yeah. Yeah. This takes practice, right? So as a physician, I've been trained to actually ask perfect strangers about their most intimate details. That's like part of the training. And so we should have the skill set to be able to talk about anything, I think, in primary care. I think it's actually all on the table because I care about the whole person. The key, though, is making sure that we're trained in the language we use and being really careful about bias that we might allow to creep into our conversations. And so I think a really good approach that I have is I kind of lean into this like Ted Lasso approach of like being curious and not judgmental, just asking really open and honest questions. I often will ask as just part of like the normal social history. So I'll ask about like tobacco, alcohol, recreational drugs, any sexual health concerns, and then I ask about firearms. And I just say like, do you have access to any firearms? Yes or no? And then if the person says yes, I just say, hey, what's the plan to make sure that they're going to be secure? What's the plan to prevent unintended access? And then I've added this in recently because I really have learned that I've got to be more engaged in talking about the mental health piece here, because that really is the big issue. In the state of Wisconsin, 70+% of the firearm deaths are suicides. I'm seeing mental health all day, every day. I'm seeing depression, patients with depression all day, every day. And so I know I got to get into that space. And the key to prevention is getting ahead of it. And so I'll often ask just like, hey, if you were to feel down, if you're feeling like you're not okay with your gun in your house, do you have a plan? Have you thought about what you might do with your firearms just to get that separation you need for a minute to kind of get back on track so you're not going to be at risk? And patients appreciate that. Patients totally receive that as, I care about you. I'm your physician. It's in a trusting relationship. I just asked about where they put their private parts as part of the social history, right? Like we're talking about like intimate personal things. Like we're going there, we're being real. And I think I'm not surprised when they say yes, that they have a firearm. And I think they appreciate that I also have a little bit of some working knowledge about what type of firearm, how might we want to secure that. Our clinic actually gives out cable locks and trigger locks for free. We don't keep track of who we give them to. It doesn't get put in the chart. I really don't document things in the chart about gun ownership because I want to open, honest conversation. I don't want someone feeling like they can't tell me the truth, because that actually gets in the way. It's a barrier to me being able to give them the best possible care. I have other colleagues who do document. That's not wrong. It's just my style is more of, I'm only going to document if you actually say like you're going to go hurt somebody or you're going to hurt yourself. And that's because I'm a mandatory reporter. I have to actually document those things. It's like part of my professional obligation. But that's the only time I would actually document about firearms. And it helps to not be like, tell me more about your guns. I'm like typing all this stuff in the chart. I mean, that's just not going to play very well, right? I mean, Kevin, you're kind of smiling because you just feel how uncomfortable that would be, right?
Yeah, it seems like the sitcom of the mental health, telling them about all your issues and taking notes. Looks
Yeah.
concerning from the patient perspective.
Yeah, just sitting back in smug judgment, basically, right? Yeah.
Mike, you're on mute. It's okay. It's Walk the Talk After Dark. We'll figure that mute button out.
I'll figure this out one day. Trust me. No,
I'm glad to be
sorry.
on your
If you
guys'
wanted
first
to hear,
podcast.
if you wanted to hear dogs barking earlier over James talking, that is why I had to hit the mute button. But anyways, okay. So here's the thing. I think about when I first got into this space, and then, having these discussions with people, and mostly it was people were coming to me as if I was some sort of expert when it came to why doctors were asking these things, and they had no idea. I had no clue. But one of the things I couldn't understand is why couldn't a lot of the doctors be transparent? The reason why I'm asking you this is this. I felt like a lot of people that came to me with examples gave me examples where the person would just say, like, do you have guns in the house? And it just left it at that, which kind of like gives you the opportunity to lie, right? So I don't know. What are your thoughts on that, James?
And it's like, why that would be really disconcerting to me. Like, that's just coming out of left field. Like, why are we talking about this? And so I think we know language matters. There's really good studies actually from patients who receive care at the VA that when the doctor is transparent and shares like, hey, I'm asking because I want to make sure that like you're okay, that we're like keeping you, just being mindful and keeping you safe with respect to like your mental health and suicide, and also just looking out for your family. When that's explained to the patient, they're open to talk about it. They're open to have a discussion. And I also think when the physician doesn't take the position of being the expert, because we're often not, but takes that position of being a learner and letting the patient actually teach them a bit about their firearms and the way that they use them and the way that they're actually being responsible with those firearms, I think that goes a long way as far as just building trust. Because when you feel like you're being seen and heard, it really matters. When someone just comes at you from out of the blue, it feels like, why are you asking? Are you documenting this? Are you going to put me on some kind of a list? That kind of thing. I could totally see how that would create some paranoia. And I think when we actually transition to these really important topics, I mean, I was taught we have to have like a normalizing statement. So like, I wouldn't just randomly start asking you about like, if you use recreational drugs or if you have any like concerns about your sexual health. I wouldn't go there without like first saying like, I'm going to now ask a couple of questions about this part of your health because of this. And then I'd launch in. And that's how we train learners. But I don't know, maybe the time crunch or the physicians feeling uncomfortable with the topic, they just kind of go there randomly. I can't speak to how or why people would go to that kind of a random place. I think it's not great people skills, to say the least.
Right, right. So having said that, like I remember but like some people would come to me and they'd actually tell me that they were given a chart to fill out, and it was just like a yes or no question, right? Like no explanation. And immediately people were like, I'm not even touching that one. You know what I mean? So, maybe that is what it is. Or maybe the person, if you checked yes, they would kind of give you an explanation. But it just seems like your work is super important to point out these things. Here's what not to do. You know what I mean? If you want to get your patient to lie to you.
Yeah, and I think just some practice around how you might ask. I actually will teach people like, hey, here's some lines you might want to use just to help normalize the conversation. I say all the time to patients, hey, in our state, about half of homes have firearms. I want to check in to see if you have access to firearms. It's that simple. And then if they say yes, no, then we talk about, what's the plan to be responsible? What's the plan to make sure that we're not going to have unintended or unauthorized access? And that's really helpful. Leaning into that responsibility piece, like honestly, if you're not going to be responsible with your firearms, we might all agree, like, I'm kind of concerned about that. It's like we all should be responsible. There's some pride in that, right?
Yeah, I mean that's kind of what Walk the Talk America is based off of, right? Is responsible gun ownership. That's one of our key,
100%.
points that we like to make. So it's just, it completely makes sense. So you're a family medicine doctor. Did you cut your teeth like in a lot of rural places? I'm just thinking of Wisconsin, and like some of the places we went to speak in Wisconsin, it was like 100% of all gun death was suicide, right?
Yeah, I mean, you definitely were kind of in the upper part of the state there. So I did all my training. I grew up in the Milwaukee suburbs actually, and did
Okay.
all my training in Madison, which is south central Wisconsin. But had a chance to actually during both medical school and then also residency go out into outlying areas around the state. So I had a chance to spend a month up on the Menominee Indian Reservation. I spent a lot of time up in the Green Bay area as well, doing training in other areas. And so just a chance to really get a sense of the state, because I mean, I grew up kind of as like a city boy, right? And just a chance to have a sense of, it's a different vibe when you're outside of Milwaukee and Madison, when you're in Wisconsin. And I have patients who come in from outlying areas. In Madison, we're not that far actually from like the countryside. And so I'm taking care of folks who live on farms and, who actually have a firearm at the ready because they've got coyotes that are messing around with like their calves and things like that. And so I'm going to talk to that patient really differently about their firearms than someone who just owns a Glock for personal protection that they might use once ever. It's a very different approach, and just understanding the nuance is so important. And actually getting to know why the person has a firearm makes a big difference. I kind of talk about someone's guns like I'm asking about their kids, like, what are your guns up to? Like, what do you use them for? And just in a really comfortable conversational style, without judgment. And then I'll just ask and wait for a response back, and just allowing that space, I think, makes a big difference for folks to feel like they can answer. And the reasons for having a firearm in Milwaukee are really different than, if you're up on a farm, a couple hours north of here. It's a really different reason. And just understanding though that those are good people who have the right to own their firearms, and there's nothing wrong with owning a firearm, and just got to make sure that they don't feel like they're being judged or ostracized because of it.
So we have some people in the chat that are chiming in. DJ Play Nice said, thank you for being on the show, which, like I said, we do appreciate it. This is not your bailiwick. This is not the thing you do, right? Like, you're a doctor. You're coming on a guns and mental health podcast, which is awesome.
Glad to be here.
Tavis asked, yeah, no, that's great. I really appreciate that, because it's not the easiest place to go into, right? Especially when you don't know what you're walking into. But Tavis asked, why would a doctor record a person if a person had a gun, if the person wasn't at a risk, not at risk? Well, now, do you think that happens? He's saying, why would they? But I kind of have the suspicion that some people probably would put that in a record, even if the person wasn't at risk.
Yeah, I think some people just want to document just things in the chart. And so it's like, you use tobacco, you drink alcohol, you work at a, I don't know, the car dealership. I mean, some people like to have that information in the chart about their patients, and that's like the social history. And so that might be why. I honestly feel like, because of the reservations that exist around this, that I'm not a fan of documenting unless I'm concerned about a risk. I also recognize that ownership changes, and I don't want to get lazy and assume like, oh, you don't own, or oh, you do own, and then I stop asking, because I actually want it to be just a normal part of our conversation. Just like we're talking about all sorts of other things, human beings are dynamic, and so things change. And it's important to me to make sure I remain curious and I keep asking questions, so that I'm giving the best possible counsel to the patient at that one visit.
So for other doctors, it's a mix of kind of like having as a social profile, just listing everything. And then for others, maybe it's, okay, this isn't a concern now, but something to keep in mind if maybe they are showing signs of struggling mentally.
Yeah, right? I think that's possible. I mean, I think honestly, whether it's in the chart or not, if someone is expressing, signs or symptoms of depression, I'm concerned about them having like suicidal thinking. No matter what's in the chart, I should be asking about access to firearms. I should be asking about a plan to end their life, because that's actually my training. That's what we're supposed to be doing. And whether it's in the chart or not doesn't matter as much as have I asked the right question in that moment. But
yeah,
go ahead, Mike.
No, I was just saying, I'm thinking in my head right now, I'm obviously super pro 2A, and I my first thought is never to take away someone's gun or remove them from their gun. And I'm just trying to think, one of the reasons why I might want to note it, especially if I have a relationship with this patient, in terms of they go through a crisis one day, and then I want to prescribe some sort of medication for them to try. It might help me to go to the chart and say, oh yeah, that's right, he owns a firearm, and one of the side effects of this medication might be this. Let's just address the elephant in the room, right? I'm meaning no harm any other than I'm just documenting it, just in case we take a left at the road or a right at the road, and then that direction may need me to tell you something. You know what I mean?
Yeah.
Even if that's, hey, the first week you're on this thing, or 2 weeks, keep that gun locked up, or let's restrict access to it, and document how you feel in a journal. I mean, it could be something as innocent as that, right?
Yeah. I mean, I think honestly, it's really important as a clinician to make sure that we're really picking up the cues from our patient, because as much as we have a skill set to provide care, we deliver it, one-on-one, and it's got to be unique to that person. And so there might be times where it is helpful to have that documented. I think it's important, though, to say, and I can't speak for every physician in America, but I really don't think people are creating master repositories or lists to go back to look at. I don't think that's the intention. It may come across that way, but as I think about my colleagues with whom I practice, that's just not who these folks are. And honestly, we're just too busy to be putting people on a watch list and coming after somebody. And I understand how it could feel that way. I just don't think it's a thing. It's not something I'm seeing, at least. And I can only speak to, my own experience and the folks I know. And so maybe elsewhere in the country it's different, but I understand the concern about having things documented, but I'm just not sure that the reality of someone now is going to know you have a gun and come for it. I'm not sure that's a real thing. And I'm not saying I'm right. I'm just saying I'm just not so sure about
right.
that.
No, I think it's fair, right? I mean, I don't hang out with a lot of doctors. You know what I mean? I can't, it's hard for me to make a judgment call on the belief system that doctors have. I couldn't tell you if they're center left, center right, what I mean, anti-gun, pro-gun, or gun neutral. I just know that you guys got a lot to cover, and maybe sometimes, trying to get through it and to get to the bottom of what is wrong with the patient, some things get sacrificed, I'm sure. Before we kind of get into the program, because I do want to talk about the program you started and where you're going with this, because I think it's fascinating, but I just want to throw a scenario out to you, which, man, I would think like in Wisconsin, this could be a tough one, right? There's certain cities where I'd say like, you're probably not going to run into this very often, but then there are others or states where I think this would probably be quite common. Someone is going through a mental health crisis and they tell you, but they've also told you that they're a gun owner, but they tell you that one of the ways that they relieve stress or anxiety or one of their joys in life is hunting or going to a shooting range. How do you handle that? And I know there's no right answer for this. I just want to see like, and obviously you got to feel it out. So go ahead, but how would you handle that?
Yeah, that's a great scenario, right? You've created an artificial scene, so it's hard to get the full vibe. But the big thing is just checking in. Like, do I actually think there's currently real risk you're going to use your firearm to end your life? And so, you can be in a mental health crisis. You can be having depression, and even have like some passive thinking, or even a plan that would involve using your firearm. But if you don't have intent to use your firearm, we might talk about some ways to kind of strategize, not removing the firearm. Still, you have access to it, but maybe I'm going to have like a buddy system. We're just going to just check in and make sure someone else is just there with your trusted friend. Maybe it's the guy that you hunt with is going to just be around, and we're going to have a deal that like you go to the range, you're going to shoot, you're going to do whatever it is you want to do to de-stress, but you're always going to have a plus one, just to make sure you're good. And that to me is as important as anything. If you're like, listen, I'm going to go home and I'm going to use my firearm in my life, like time out, we got to do something to separate you from your firearm. But there's actually a lot of distance often that exists between I'm having some thoughts, even if I have access to it, to means if I don't actually have that intent, I think there may be a little more wiggle room to really try to craft the right plan. I don't want to come in and take away someone's right, but I do want to make sure that I get it right for them. And part of that means just making sure we're being responsible. And I have a lot of folks who have a buddy who will just hold their guns for them. And they're like, honestly, I'll have my friend, my brother hold it for me, my dad hold it for me. And then when I want to go shooting or we're going to go hunting, like we're all going to go together anyway. So it's totally cool if it's outside my house because I'm not going to need it inside my house. If it's a hunting rifle, for example, it's a different scenario if it's actually a handgun or something they're going to use for personal protection. Right. And so that's where I got to feel them out and see kind of what are they thinking, and then really try to make a plan with them where I'm honoring them, but also I'm going to like put on my adult professional pants and be really clear about if I have concerns, and then try to negotiate with them the plan that's going to feel like it's the best fit for them.
Okay, yeah. And the reason why I asked that is I came across a series of videos put out by John Hopkins one time. And in one of the videos, this wife was in there talking to the doctor, and the doctor was pretty much recommending red flag, right? Like, we need to red flag your husband. And it was really interesting because in the video, they bring the husband in and they try to lightly present the red flag law to the husband, and the husband is, in my opinion, this was the fakest video I've ever seen in my life. He was like, well, maybe, but here's the thing. I really enjoy, like, one of my only pleasures in life is hunting with my buddies, and I won't be able to do that. And they're like, you'll be able to do it in a year. And I was like, man, I don't know if this is like the best way to handle this situation, because the guy just told you one of his joys in life, he's depressed, and now you're going to snatch that from him. So that's why I ask you.
Wisconsin doesn't have ERPO, so we don't actually have the extreme risk protection orders. So that's not even something at my disposal to even offer as a possible option for the patient. But I would say the key is going to be honoring the person, not over reacting and maybe overstepping. And these are really hard decisions. I mean, just to be real, like the decisions that I make every day as a physician are really challenging. and it's hard to get it right all the time. But I think the key is to make sure that you're keeping that patient in mind, and not doing something that's just from your own bias, like the easy thing. It's got to make sure that it's really right by them, because folks have the legal right to own firearms. And really, I think unless they've really stepped in a certain direction where you think it's absolutely they're going to act and have intent to act, I'm not sure where that line is. And I haven't seen that video from Johns Hopkins, so I can't speak to it. But I think it's probably just framing the ERPO, like how you can bring it up in clinic, is probably what that video is my guess. And those video, anyone who does those standardized patient scenarios knows it's hard to make them feel authentic. All those are going to feel kind of artificial.
Yeah. It was a cartoon that they made a series of cartoons.
Okay.
Yeah, and it was just goofy, but yeah, it's really interesting. And one last question, this is more or less just curiosity. Have you ever had a patient where you knew that they kind of turtled up after you asked them about their guns? Have you ever, whether it was insulting just because they're like none of your business, or someone who was worried that you were asking for a nefarious reason?
Yeah, I have two scenarios to share. One is I had a patient get really mad at me and actually just like went off on me for asking. And I like backed up and was like, hey, just 1 second here. Just hold on. And he's like, you're being political. Like, how dare you ask me? And I just said, can I reframe this and just ask you, if I was talking to you about wearing a seatbelt in your car, would you feel like I was being political? And he's like, you're trying to trick me. And I'm like, no, I'm just telling you, like, this is about risk reduction. I just want to check in to make sure that, like, you've made a decision to have a firearm. I want to make sure that, like, we're also doing things just to minimize risk. Just like if you have a car, I want you driving with a seatbelt on. Please don't text and drive, etc. He did not like that. He found a new primary care physician. That's okay. That's his choice. I still offered him all the care that he wanted. I said, what else can we do? We can stop talking about this. He was really heated and decided he was kind of done. And that's okay. That was his choice. And that's like the only time of like probably the 1,000+ times I've had this conversation, I've really had someone get like very visibly and audibly upset. I also had a patient who told me that I kind of surprised him with my question and he was planning to lie to me. But then when I surprised him, he was like, I had to tell you the truth. And it was this really funny moment of like, why are you going to lie to me, man? Like, come on, bro. Like, I'm your doctor. And what it amounted to is he had just actually been out to the range and he has 2 small kids, and had a couple of his rifles just like in a duffel bag. They weren't locked. And he's like, oh, I was going to lie, but I have to be honest. They're not currently locked. He's like, when I get home, I'll get them back in the safe. I was like, awesome. And then it actually prompted a conversation about how he stores his ammo. And he had his ammo in an unlocked drawer at like waist height, and he had a toddler. And I was like, so can your toddler get to that drawer? He's like, yeah. I'm like, can your toddler open that drawer? He's like, yeah. I'm like, does your toddler put stuff in its mouth? He was like, oh my gosh, I need to lock that drawer. I'm like, you need to lock that drawer, bro. And it was like,
yeah.
And it wasn't like, I'm not putting him on blast. I'm just saying, like, let's just think about your living environment and how you're actually like storing these things, and what's the plan to make sure like we don't have that unauthorized or unintended access. And it helped him actually to be like, I just got to lock that drawer. And I was like A+, way to go. And I think he felt bad. Like, how did I not see that? That's the nature of a blind spot. We all have that. And I think that's the whole point of like why I want to have these discussions, is just to help people understand where they might have an area that's a little bit soft, or where they might be a little bit at risk, and not to make them feel bad, but just, hey, maybe this is one more thing you could do just to dial back that risk just a little bit, because you and I both love your family. You and I both don't want your kids to be injured. Like, what could you do? A real easy lock on a drawer, or just like move them someplace else, put the ammo in a tackle box and lock it, whatever. And I think that guy who's going to lie to me was like, thank you so much. And he was kind of like sheepishly, like kind of smiling as he was like, I'm glad I didn't lie to you.
Yeah, that's cool. Yeah, thank you for sharing those stories. That's awesome. Tavis has a great question. He's got 2 good questions, but I think the second one is more just discussion. Does Wisconsin have a 72-hour hold? Do you have any kind of like 5150 law?
Yeah. Yeah,
for
so
people in
so that's the.
crisis?
I mean, I think most states have this, where if there is a concern about someone imminently being at risk to themselves or others, they can be held, and that essentially is, police or law enforcement can be involved in those.
Clearly, there's no punishment for that, or is there? Would that get you on the NICS check in Wisconsin? Do you know?
Oh, that I don't know.
Okay, I'm just curious. Clearly, you've never enacted one, so
Right.
I
And I
assume.
mean, at some level, I want to actually be working upstream on this. I want to be engaged. This is why I actually want to be talking all the time with my patients, so we have a plan in place, so we don't get to that. I don't want to get to that
Right.
point. I want to actually have a much more controlled situation where the patient is completely in control of what's going to happen in the plan, so that it's not someone coming to snatch or take away, but actually they're empowered to say, hey, this is what I want to have happen so I can get through this tough time. That just honors the
Okay.
person.
So no, that makes sense. Kevin, do you have anything more on this subject before we kind of move to the program?
Yeah, James, if you knew someone was a gun owner and they were creating a plan, what would be the difference from your perspective as a provider between a C plan, a B plan, and your ideal A plus plan for those types of individuals?
As far as how they're going to like secure the firearms.
Just yeah, like are there any details of like, hey, this is kind of like the bare minimum of like I'd like everybody to do. This is what some people are doing that I love, and here's would be my dream that if everybody had in detail in their plan, it would be perfect.
Yeah, so I just basically quote the NSSF, and then I recognize that's probably more focused on like hunting rifles. And so then I just modify it to talk about if you have a firearm for personal protection. And so the NSSF basically says like all firearms unloaded, all firearms secured, all ammo stored separate and secured, and then inaccessible to kids or unauthorized users. And it's all firearms. If so, and that's what I'll talk about. And if someone says, but I need a firearm for personal protection, then we talk about what is the gun or guns you're going to use to protect yourself, if it's your concealed carry or something else. And then what's your plan just when it's off your person to make sure it's secured, to make sure no one else has access to it. And we'll talk about things like a quick acting lockbox or like a small safe, things like that, biometric, punch code, whatever. I actually have a couple in my office that I'll bring into the exam room to show my patients so they understand actually how quick and easy they are to use and how inexpensive they are. I also think it's important with the number of concealed carries we have. Our clinical spaces don't allow firearms. And so I tell my colleagues all the time, I said, hey, guess where the firearms are, everybody? They're in our parking lot. Because people with concealed carries take their firearms off their person to come into clinic. And I want to make sure that those patients are being encouraged to secure those in their car before they come in. It shouldn't just be like, in the glove box unlocked or like between the seats or under the seats. I really do encourage folks to have like some sort of a lock box that's going to be, cabled around like the post under their car seat or something like that, the frame of the car. And patients appreciate that, when that thoughtful touch of like, hey, I know you can't bring your firearm here, so make sure it doesn't get stolen out there. And actually letting them know that like half of guns stolen out of cars are stolen out in front of someone's house. Like you should be securing that thing in your car so it doesn't get stolen. It's expensive. It's a really expensive thing to have taken from your car. And the people who steal your guns
Well,
don't do good things with them, right? Like
exactly,
it's
and
not like
then
the
and every one of those instances will be used against us, right? If you really love the Second Amendment and you care about what happens to us, we all have to recognize that if we do something silly, and even though one can make an argument that a car is a locked box, but technically it's an easy break-in, right? You smash a
yeah.
window, you're in, right?
Well, I don't know,
Right.
you can like fish some plastic down and open up a car door, right? I mean, it's not
Exactly.
it's a
Yeah,
it's
and that gun
a
gets used in some kind of crime, it's another statistic towards us, right? So it just makes sense to secure your firearms when they're not on your person. Make sure that no one else can get to them, unauthorized access.
but I do a lot of like when patients are saying, oh, yeah, they're all unloaded and they're all locked up, but my ammo's not secured. I'll say, hey, that's like an A, good job. One more thing to think about is like, you don't want your kids being able to get into your ammo. So like, is there a way to like secure those or put that someplace kind of tucked away to be more secure? And it's always just about like, quality improvement. And I mean, this is sort of like the nature of like being in medicine is like, I'm kind of never satisfied. I always want better. And I think it's kind of my personality. And so it's always about what's the one more thing we can do without making someone feel bad or like they aren't doing a good enough job. But just like, what's that one more step? And so I have folks who, have cable locks and trigger locks on their firearms, but like don't have an actual like full size safe. And honestly, given what they have, it would be a smart financial decision is to get a safe to protect their firearms if they have a fire or if someone breaks in. And so we talk about like options they have, and I'm not coercive. I don't tell them they have to. It's just giving them a bit of a chance to think about and kind of brainstorm and be kind of more introspective about it. And then I set them free to do whatever it is they want to.
Yeah, one of the things when we were at the conference together in Seattle and just looking around, and remember how they had that like that center section where there was all the tables for people that were displaying. My first thought was, hey, you got gun people here now. That's a first step to this conference to make this to I think help everybody, right? Like having the actual people of the firearms industry there. But the second thing that I thought of was all the technology that we have needs to be on display for all of the researchers and all the doctors like yourself that are there so they can stay up to date with the latest and greatest tech, especially if they're not gun people, right? Like,
For sure.
I don't know what the latest and greatest is in, say, like, drones, right? But if I had to talk about drones, I'd want to know what accessories are there, with patients and things like that. But I see it the same way. So I think like that is definitely one thing that with the work that you're doing and the work that researchers are doing and the conferences and things like that, I think that presence needs to be there so they know that it exists. So when someone comes into your office and you're like, hey, check this out, we have this new technology, something like a gun alert or, Oculus or something like that,
Yeah, I mean,
that
I
they know
think
it's there.
I'm surprising my patients when I show them like something that they can use that's readily accessible and not that expensive. And they're like, my gosh, I'm going to buy that. They like pull out their phone and take a photo and like hop on Amazon or go to the local gun shop to make a purchase. Cause it's just, oh, I wasn't aware. That's so awesome. Yes. Like, thank you. It's genius because it's so simple. I hadn't thought about it. Right. That kind of thing.
Yeah, no, that makes sense. So let's talk about the program a little bit that you put together, the lock, stock, and barrel.
Let's do it. Should I
Okay,
talk about it?
so yeah, I need you to talk about it, brother. You're the genius behind it.
I will tell you that this was gifted to me by a colleague here in Madison. So Jean Papalia is a retired police officer, and she works at a suicide prevention nonprofit here in town called Safe Communities, and she really did a very cool thing in helping get me connected with a local gun shop just maybe 10 miles down the road from where I practice. And her idea was, hey, you really do need to connect with a local gun shop so that you can develop some just competency around talking about firearms and actually having a space to refer folks for purchase of securing devices, for training. And then also here in Wisconsin, we participate in the gun shop project. And so folks can actually take their firearms to 4 dozen gun shops around the state for a voluntary transfer if they need. And it's often it's no cost or very low cost, and it's no questions asked. You can hand over what you need to hand over, and then when you feel like you're okay to get your firearms back, you can come back. You still do a background check, like if you're buying a firearm, but as long as you pass the background check, everything comes right back to you. And what's awesome is we just basically take a bunch of learners, and it's medical students and residents and faculty, physicians, folks who've been in practice for years, and we can go and honestly ask any question. And we can be a really novice learner and ask things like, what's a bullet? How does it work? What's the difference between a handgun and a revolver? Or what's semi-automatic? What's a shotgun? What's an AR? And we have a chance to actually then like hold and handle various things. And it really demystifies firearms for people. And so it's a chance to actually learn a ton about firearms and actually how like what do you do to purchase a gun, and what are the sorts of things even that the gun shop owner is looking out for as far as like straw purchasing and other things that he's already doing to try to keep all of us safe, right, by being responsible as an owner as he's selling firearms. And then at the end of our time, we have an optional chance to go back into the range and actually shoot, and we'll often shoot like a handgun, a shotgun, an AR. It's amazing to watch folks who've never handled a firearm shoot a gun for the first time, and just watching, I can watch people just feel like, oh, I got it.
Mm-hmm.
I understand why
Yep.
people own firearms. I understand why people enjoy having a firearm. Or I understand the sport of shooting, and just the sheer power. I think is one thing. And many folks would say, well, you don't have to shoot a gun to be able to talk about firearms. That's true, but I think for some of us who like really never had the experience or really felt very reserved about this because we just didn't have any working knowledge, getting into that kind of a space and actually being able to use a gun, it makes a huge difference as far as the confidence to be able to talk about it. And it's not that you have to shoot an AR, but boy, once you've had a chance to do it, you actually understand why someone might own an AR. And you suddenly create more space in your brain for understanding other people. And you can't then sit back in judgment of like, oh, you're bad because you own a gun or guns are bad. It actually creates a much more robust understanding. And I think it's actually the beginning of some, cultural humility and some cultural awareness, which is really important, I think, for us as physicians as we talk about this.
Yeah, it that resonates with Kevin and I because we have obviously the cultural competence course that we teach. We've traveled. I remember one instance, and I think Kevin remembers this. We went to Oregon, and there was a moment in the course where we go over the different types of firearms, and we held up the AR and basically said, "Anyone want to come up here and hold this thing, or to see what it feels like?" And one of the ladies that actually volunteered went up, and the person who was running the event, who had actually paid for us to get there and put the presentation on, was like, I can't believe that lady actually went up and did that. She is the most anti-gun out of all of us. You know what I mean? And it was great because she was participating. She put her fear aside to learn, and I got to see that it's not this big, bad, scary wolf, that's going to jump out of her hands and just start killing people. You know what I mean? And it was really cool. And I've actually stayed in touch with that lady, Kevin. I'm not sure I've ever told you this, but like we stay in touch to this day. Sometimes she will call me for things, and she actually goes to the range now and shoots. Like she's become a firearms owner. And I think that this is what we're trying to do, right? It's not that we're trying to get everybody into this, but we're just trying to get people to have a different perspective on it. And I think, what you're saying is perfect. And another point I'd like to make about our cultural competence is I remember the very first time we threw it in Reno. One of the clinicians was like, man, he didn't even know that people would be afraid to talk about their firearms with him. He was in shock that people would be scared. Right. So that's why I try to tell gun owners all the time and gun people like, hey, there's nuance here. There's a lot of people that don't have ill will. They may be clueless to the fact that this fear exists. So we got to be patient.
Yeah, I think that's fair. One of the things that to me was really eye-opening was I do a lot of training with our residents. I do training with our residents in family medicine and pediatrics, emergency medicine, psychiatry, really specialties where I think this is on topic to be talking with patients. And one of the residents actually shared that they grew up in a rural part of the country. And when they went to the pediatrician, they were coached by their parents to say that they didn't have firearms. So this person who is now a doctor in training says, when I was growing up, I was told not to talk about this. And as we unpack just like, what is it like, how should we approach this? They had to almost like unlearn some behaviors about like, you don't talk about guns with the doctor. And part of it was just helping that person understand, like, I think it is okay to have these conversations. We don't have to force them, but if the person is open and willing to talk about it, then we got to just be ready to have that conversation. We got to be trained up so that we can actually have a meaningful conversation and not just kind of get exposed as not really knowing what we're talking about.
Yeah, Tavis asked a great question earlier, and basically was asking about the law that there's like a child access prevention law that makes it a crime to leave a loaded firearm in reach of a child under 14. And do you bring up that law a lot? Do you talk to your patients a lot? No.
No, so I actually don't talk. I don't think my job is to talk about rights or laws. I want to talk about injury prevention, and I want to encourage responsibility. And so I don't bring up like the laws. I just talk about being thoughtful, having a plan, training, and just I actually want to engage more in a dialogue with the person about, what are their thoughts why are they using their firearm, and then what can we do to try to make sure that we're going to like make the risk as small as possible for injury to self or others.
Okay, and that's fair. That makes sense. Since you've been doing this and you've been having people come through this course, is there any particular story you want to share? Can you think of anything that's like really special? Did you ever see someone completely change their mind on how they feel about firearms or anything like that? I think gun owners love stories like that.
Yeah, I mean, I think honestly, a lot of times what we're really doing is taking folks who were maybe avoiding firearms and scared and nervous and felt like they couldn't go there, and just really helping maybe take away some of the bias that they had. And in a lot of ways, I think it is, I use the word demystify. I think that really is the best word, is we take away the mystery of the thing. And it actually is really empowering, I think, for folks to feel like, oh yeah, like I understand that. And it's really about like this epiphany like moment where I watch people get it. I watch them get it, and then I ask like, hey, are you gonna then be able to talk to your patients about this? And it's amazing to watch folks who are like, I never talk about this, to suddenly, after we do the training, we survey folks, and they say like, yeah, I think actually I can do this. I'm gonna do this. And I'm confident with the way that we frame the training. It's actually not anti anything. It's all pro responsibility. It's all pro, injury prevention. I'm confident with that sort of framing and that humility that we're actually encouraging, that we're going to set some folks out there to do good work and hopefully not ostracize their patients who own firearms.
Yeah, we have something in common, which I think is pretty cool.
We're
We both
both
have a
incredibly good
connection to,
looking.
well, that's first and foremost. And I think most of the listeners and people
Sorry,
that are
Kevin.
watching this understand that. Okay. But we both have been interviewed by John Diedrich.
Oh, yeah.
And what I love about this kind of connection that we all have is I'm falling more in love with Wisconsin every day. I feel like there's a lot of forward thinking there. And I think that's a place that probably doesn't get the credit, right? Because as gun owners, we're constantly thinking that, obviously it's the typical stereotypes about doctors and mental health clinicians always out to get us to confiscate our guns. Some of that was the NRA rhetoric that really put us back a few years connecting, but also too that we can never get a fair shake in the media. Right. And then you got a guy like John, who I think is one of the fairest writers I've ever seen on the subject of firearms. But you're in this article, and it's in the Milwaukee Journal Sentinel. It's Wisconsin physicians are learning about firearms to prepare them for talking to patients about gun safety. And it was a really cool article about your work and you. And actually in the article was a gentleman named Matt Miller, who I worked on the Prevents White House suicide prevention team for the VA in 2019. And Matt's a tough cookie. He's clearly not, he has a horrible poker face when it comes to firearms. He just believes that the best way is abstinence, right? The way you decrease negative outcomes of firearms is to get them away. Matt's a guy that I've argued with, but Matt's also a guy that I've had, agreed with on other subjects and had great conversations. I don't want to make it sound like it's all bad, but in that article, he kind of goes after that it's not something that you need special training in. And when I presented that to you, because I thought it was funny, just because I've been on that end of Matt's whole, his belief system, I loved your answer. So I just want you to kind of repeat it for the listener. So, because I thought the way you put it was really awesome. And it gives them a peek into the mind of I think rationality when it comes to, your view.
Yeah, I think what is said in that article is this idea that physicians, clinicians already are trained in having challenging conversations. So we have to talk to patients all the time about things that are challenging. And so we don't need specific training around firearms. And what I said to you, Mike, was, well, actually the reason why we are good at those conversations is because during our education, we are trained in how to have those conversations. So we're trained in how to actually break bad news to a patient who has an unfortunate diagnosis. We are trained in how to actually ask about things like substance use. We're trained in how to ask about sexual health and any concerns about sexual infections. And so it's actually training in practice that then carries over into clinical practice. And we have not had that, I don't think, in an adequate way around firearms. I don't know that everyone has to go into a gun shop and actually, do some active, shooting with a firearm to be able to do this. But let me tell you, there's certain folks who that's just what they need to help them feel like they got the confidence and that they actually feel like they know what they're talking about. I'll tell you, in medicine, if we aren't sure about something or we're not super confident, sometimes we're human beings. Sometimes we'll just dodge it. We'll duck the topic and we'll just avoid it. And I don't want folks to be avoidant on this because it's a really important topic. And I think to be good, you got to practice and you got to see how it's done so that you can actually learn and do it well. And I think we actually do have a little bit of something kind of going here with our training. And I had a chance to talk to someone at another medical school in a different state that's also here in the Midwest. We're talking about trying to actually expand this program there because I actually think it has a lot of merit, and I think it really is going to benefit the patients who own firearms when their clinicians actually are culturally humble and aware when we start talking about injury prevention.
I agree. In my opinion, and I know you won't say this, you're too much of a gentleman, but I think Matt Miller does not like the idea of this because he believes that this is the type of stuff that normalizes guns, and he doesn't want guns to be normal, right? And don't worry, don't say a word. I'll say it for you and everybody else. But
Look, I
think
got
that's
some
the
tea right
only
here.
I think that is the only reason why you would not like a program like yours. I truly do. And I understand sometimes people can't get over the bias they have of firearms. I think a lot of people, Matt in particular, might look at this as going, well, if we get these doctors that all of a sudden have opened their mind to this culture and then they're recommending it, or they're getting involved in it, and they're, like I said, that normalizes it, that's not good either. I think in a perfect world he'd like less guns in patients' hands, but that's okay because this is America, right? And like that's one way of looking at things, right? Like there's a lot of people, and I respect them when they tell me, I just wish all guns would go away. I don't think that would solve the issues of violence, but I appreciate it when someone lives in that world. It's a cartoon world to me, but I do understand why they feel that way because they don't want to get people hurt. And I believe Matt Miller doesn't want people hurt. And that's in his core, right? And sometimes that spills over. But having said that, I'm glad you made the program. I'm glad it's there. I do think it should be expanded. Walk the Talk America will always help you with whatever you need.
Thanks, man.
When it comes to your work, I really appreciate it. I don't know if I'll ever be attending another sporting event with you because I feel like that's dangerous for the listeners. James and I went to a Seattle Kraken game with Kenny Barlow from Regal when we were in Seattle. And James thinks it's really funny when you're standing in the middle of all the fans to yell out, "Let's go Panthers."
I just
The
want to make
opposing
sure
team.
I want both teams to have fans. I don't actually care at all about any NHL team, but it felt like the Panthers just needed extra fan base. And for the record, the game went to shootouts and the Panthers won, so I went home happy.
Yeah, well, it was funny, but man, you're fearless. It was like, I hope somebody has a firearm right now. One of us. No, but it's kind of funny though, because I do got to ask you, like, if you did that with Packer fans, would that be a problem? Because I know Eagle fans will kill you.
Yeah, really the Packers reserve most of their resentment for Bears fans. So that's a big
Okay.
rivalry. So
It's
I would
targeted.
think most other teams are going to be okay. You might just get kind of like all right, well, maybe next time. But yeah, the Bears fans definitely get a lot of heat from the Packers fans.
Hey, Kevin, is Kenny here? Is he in the chat? Did he say "Let's go Panthers"? Oh, that's great! Look at that.
Yes.
Kenny's coming in with "Let's go Panthers."
What's up? What's up, Kenny? Thanks for being here. So, Mike, can I say something just about what you were saying before? We kind of had some of these conversations as we were hanging out at the conference, and I think one thing that I wonder about is if if there is some bias that's making its way into how this topic's getting talked about. And I think it's really important as I'm in academics, I'm a clinical professor in family medicine. I think it's important that we think about when we're coming at a topic and trying to learn and study, that we keep that neutral position and remain curious so we can learn, and that we don't bring in a foregone conclusion or have our own position where we're coming from or trying to prove the point that we already had, pre-established. And my hope is, what we're doing, I think we're actually being kind of like neutral, like decide if you want a gun or not. Like, it's your choice. And then let me make sure I'm competent, though, to talk about it with you in a way that's going to make you feel like you're heard, you're seen, and that we're going to do the right thing by you to make sure we're keeping you and your family safe, so that we're being responsible and no harm's going to come anybody's way. And that actually ultimately is the goal of all the laws that are being passed, right? Or all the discussion about, what people want to see happen is a reduction in harms. And I think we have to find a way back to dialogue and find a way back to, like you'd said, some common sense around this. Because I think there is a little bit of posturing and people who maybe it's possible, and I'm not going to say anyone's name in particular, but I just feel like it's possible that some folks may actually be bringing in like an anti this or even a pro that position. And I think a better way of looking at this is a bit more objective. And that's what research in academics is actually supposed to do, is to really be a sifting and winnowing and really be open to discovery. And that's the hope of what I want our learners to accomplish, is a chance to discover. I don't want them to decide they have to buy a gun or all the guns should go away forever. I just want them to feel like they've had an awakening of sorts so that they can become more competent and just be better clinicians.
Yeah, that's true. And that's the thing I love about you, man, is that I know you're sincere about this. We spent enough time together. I mean, we went to the Grateful Dead show together at the Sphere. Like that was my first time at the Sphere. No, but like having these conversations in private, like you really get to know someone's heart, and you definitely exude that belief that you have. And I've always appreciated that. We've had some honest, candid conversations that, I wish a lot of gun owners could hear, because I think that would give them hope. Because I think sometimes as gun owners, we just feel like, man, everyone's against us. You know what I mean? Or no one understands us. And hell, we're against each other sometimes. I mean, we have to, gun owners are not a monolithic group, right? Like they believe in all kinds of things. So, I appreciate you coming on the show. I appreciate any of the listeners tonight sharing, hey, I listened to this show and there was this doctor on there and he was just saying some really cool, nuanced things. And it gives me hope. It gives me hope. And tell that to another gun owner. Not all doctors are out there just trying to take your shit, or take your right from you. So I think that, that's a positive thing. And that's why I'm excited to see where you're at in 3 years with this work that you're doing. So I know we got plenty of conferences and plenty of concerts to go to.
And maybe some sporting events. I'll be on better behavior.
I'll just be wearing if I'm going to a Kraken game, I'm coming to a Kraken jersey. That's all. So I could just be like, this is my friend. I don't agree with it.
He may have issues. We're not sure.
He has Panthers Tourette's. He likes to yell. No, but we're getting to the end here. I want to be respectful of time. We have one question we love to ask our guests. How do you tend to your mental health?
Yes, that's an awesome question. I think that's an important question to be asking folks, because we got to be caring for ourselves, right? Super important. Honestly, a really big thing for me is I love music. I actually love going and seeing live music and just having a chance to kind of unplug. And so thanks for going to the Sphere with me and seeing Dead and Company. That to me is a really cool moment, just to kind of unwind and kind of unpack the day. And I'm not saying that I have the most stressful job on the planet, but some days are harder than others. And I get a chance to kind of slow down and take a minute and just kind of be in my own space, listen to music, and just having a chance to unwind and actually not have to always be going and performing and providing for somebody else. That makes a big difference. And then the doctor answer is also like, I try to make sure I'm like moving my body and exercising, right? I'm supposed to say that, I think. But I think I've really learned a lot about myself through the years, that I need that time that personal time, and that matters a lot. I mean, just having a chance to decompress and just kind of let my mind like not have to always be going is huge. It makes a big difference.
No, that's awesome. And on that note too, like obviously, you know, you're a busy man, but if someone had wanted to reach out to you, you know, like even Tavis in the chat had a great point. He said, does he have any academic papers I can read on this?
Yeah, so we actually we had 125 people go through our lock, stock, and barrel program, and we did a post session survey. And you don't get everybody, of course. Not everybody actually answers your survey, but we got some really nice data as far as like pre and post, just kind of like perspective shift, and we're going to be working on that, and hopefully it's going to get um, published. I'm hoping in the Wisconsin Medical Journal later on this summer. So if there is a citation or publication, I'm happy to get that to you, Mike, to get out to folks.
Okay.
And I'm easily accessed. I'm a state of Wisconsin employee, so my web or my email, I should say, is public domain. It's just my name, james.bigham at wisc, which is wisc.edu. And I'm happy to have folks reach out if folks want to chat or further the conversation. And honestly, I don't have all the answers. I'm here just like everybody else. I want to learn. I want to lean in. I want to get better. And so I'm not satisfied. I don't think I'll ever probably be satisfied. I want to make sure we're getting it better and better, and actually making sure I'm getting it right for the person in front of me that I'm seeing in clinic day to day. So I look forward to more conversations. I want to learn more. And I got to say, thanks, Kevin, for having me here today. Thanks, Mike, for having me here tonight. And I appreciate you guys you poured into me and helped me learn a bunch and get better myself. And so I just want to say thank you. I appreciate that.
Yeah, of course, of course. And before we exit here, G-Webs, one last thing, one last comment, but just this helps give you the mind of Pro 2A gun person. I know G-Webs personally, he's a great guy. He says, I don't think doctors want to take out guns because they all hate guns, but I do think doctors would take guns because they think they need to or don't see any harm in that. I think it's a valid point. And that's something that you could tell the people that come through your course, that's a viewpoint of a lot of gun owners.
Yeah, I think that's super helpful. Thanks for sharing that. I think this is actually where it's important to be normalizing the conversations, because I think as physicians learn their patients who own firearms, it does in many ways normalize that family people and good upstanding citizens and people who are wonderful husbands and wives own firearms. I have friends who own firearms. I personally have friends who own firearms. They're not bad people. And I think that's where we need to make sure we do that heart check and that pulse check, that we don't bring in this bias that if you own a firearm, then you're something other. It's a negative thing. And there's probably some truth to the fact that, as physicians, we're trained to try to reduce risk. And we probably still have, many of us are still steeped in that. If we can get all the guns away, people will be safer. It's not practical. I think the abstinence only comment is a really good one, Mike. Sure, the way to reduce the risk of unintended pregnancy and to reduce the risk of a sexually transmitted infection is abstinence only. I just don't think what I know about human beings suggests that's pragmatic and it all going to work. And I think actually, if we use a similar kind of lens as we think about firearms as clinicians, as physicians, it may help us understand that we take the abstinence only, really absolutist position. We may be losing credibility in that moment, and we may not anymore have much of a voice to talk on these things with our patients, because it's just out of touch with the person. And you don't have to agree.
That's fair.
You don't have to agree that someone should or shouldn't. That's actually not my job. My job's to make sure that I'm caring about you, caring for you, and I'm doing right by you to make sure that we're keeping you healthy.
Right. And can you make a personal guarantee to all the listeners that you will not stop your work until every single doctor or physician is talked to about this and you've changed their mind about the way they feel about firearms?
I'm going to do the best I can.
We need the Dr. Bigham guarantee right now, brother.
That's my agent. Hold on one sec.
All right. Well, listen, thank you for coming on the show. I look forward to the future. I think I speak for everybody on here, and Kenny, you are an awesome guy. And look forward to having you back on to talk about the success and journey. I want to thank all of the listeners for tuning in tonight at the After Hours show. This wasn't that bad, Kevin. Wasn't that bad. Maybe we should change
It's a good way to celebrate 33.
That's true. Happy birthday, Kevin. It's
Oh my
Kevin's
gosh.
birthday.
We did this on your birthday?
We did.
Yeah. That's how dedicated Kevin is.
You were the man. Happy birthday. I
Thank
hope
you.
there's like cake in your future or something.
I got a little cake. We had a podcast right before this, so I had to scarf some pizza, get a little cake, and then jump back on.
Mike's working you like a dog, man.
He is. There's a whole birthday party in my living room. I just have to do this before I can return back to it.
That's why you keep looking over, right? The kids are like, when is dad
I'm
coming back
waving.
to his birthday?
I'm so sorry. I should have shut up. I didn't know. I'm so sorry, Kevin.
All good. I enjoy it.
Yeah. So listen, thank you everybody for joining the show. I want to thank all of our sponsors, of course, the Rugers, the Arms Corps, everybody else, the NASGWs. We could not do this without you. We really appreciate your support. And until next time, we wish you better mental health. Thank you and have a good night.